That information, is there any objection to it being tabled? No, it can be tabled. Question number 6. Dr. David Clark.
My question is to the Minister of Health. Does he stand by his statements in response to yesterday's urgent question on the typhoid outbreak in Auckland, where a 52-year-old woman has died?
The Honourable Dr. Jonathan Coleman.
Mr. Speaker, yes.
Supplementary question, Dr. David Clark.
When should his officials have publicly notified there was a death caused by a typhoid outbreak? The day public health officials learnt about it, 3 days later when the Ministry of Health finally found out, or 4 days after that once family members, church and church community had come in contact with the woman who died from typhoid fever, as well as other potentially affected relatives and community members?
The Honourable Dr.
Well, Mr. Speaker, that's a matter of judgment, but I think what can be said is that lessons will be learnt from this whole episode. The point I would make, though, is that typhoid is actually spread either by waterborne means or by handling of food by people who have been infected. So there is not a risk, I'm advised, of contracting it from a person who's deceased.
Supplementary.
Supplementary question, Dr. David Clark.
Can he confirm that the woman who died, her friends, her immediate family and 2 connected church communities were never told by his ministry she had typhoid fever, and that it is contagious, and that these communities only learnt of the seriousness of the situation through media reports 1 week later?
The Honourable Dr. Jonathan Coleman.
No, I can't confirm that. It's not the role of the Ministry to communicate information. It would be the role of the Auckland Regional Public Health Service. They have the responsibility in this case.
Supplementary.
Supplementary question, Dr. David Clark.
Does he think it is adequate to have only one dedicated professional with Samoan language and cultural expertise in an already stretched Auckland Public Health Service to respond to disease outbreaks in a population of over 1.4 million people?
The Honourable Dr. Jonathan Coleman.
Well, that's an interesting and valid question, and that's one of the matters that will be addressed in the debrief. And look, just listen to the answer. And they do need to look into exactly what's gone on in terms of the liaison and the communication, and that's an important point that will be raised.
Supplementary.
Supplementary question, Dr. David Clark.
Were cases at Auckland Hospital isolated and quarantined as soon as typhoid was diagnosed?
The Honourable Dr. Jonathan Coleman.
All the advice I've had is that they've been absolutely clinically correctly handled. Well, it is
Supplementary.
Supplementary question, Dr. David Clark.
Isn't it actually true that when this woman died last week on Monday, public health officials already knew they were dealing with typhoid, since they had been dealing with an outbreak since as early as 20 March, when 3 other members of the same Mount Albert church community were admitted to hospital subsequent to an earlier church event?
The Honourable Dr. Jonathan Coleman.
My understanding is that 20th of March was not the date of the notification of the first case. But look, all this will come out when Auckland Public Health review their handling of this whole outbreak.
Question number 7, Ron Mark.